Hello and welcome to another episode of Careers and Coffee. Today is Tuesday the 4th of May and today I am delighted to welcome Dr. Paul Driscoll-Evans, who is the Dean of the School of Health and Sports Sciences at the University of Suffolk. So, hello Paul. Hello, how are you? Nice of you to join us.
Oh, it's my pleasure. Thank you for having me.
And isn't it wonderful that the rain has finally stopped and we have sunshine, which is really good.
It's not sunny here, so you might have the clouds coming your way shortly.
Oh, well, hopefully they're going to stay away. We've had enough of those. But enough of that. So you are the Dean of the School of Health and Sports Sciences at the University of Suffolk, which is a very long title. But prior to that, your original background was actually you trained to be a nurse.
I did.
But just to sort of take things right back to the very beginning of your career, when you were at school, what did you want to do?
That's a very good question. I really didn't know for a very long time. And so I'm the first member of my family to ever go to university. And still to this day, there's no one who's ever gone to university in my family. So I never had some really positive role models in terms of education. Both my parents worked and were fantastic role models in lots of respects, but I wasn't really given the gift of aspiration from an education perspective. So I didn't know what to do. And I did my A-levels and I did relatively okay. And I got a job in a bar for 9 months and thought, actually, I want to do more than this. But before that, I didn't really know.
What subjects did you do at A-level then?
Oh, gosh, that's a really good question. I did performing arts, English, and sociology.
So not really the kind of traditional subjects that most people would associate with preparing you for a career in nursing. So what happened after that and how did you get into nursing?
Well, I think I always enjoyed, I now look back on those choice of subjects, and I always had a real interest in the world, and I think that was in the sociology, and I really enjoyed communicating and learning, and that came through the performing arts and English. So I spent about 9 months working in a bar, and I thought, actually, I can do more than this. I literally, you hear all these people say I was struck by this massive bolt of inspiration, and I quite frankly wasn't. I didn't want to be a nurse from the age of 7 or whatever. And I looked and thought, actually, what's a job where I can get a qualification and I can study and learn and make a difference to the world. So at the end of the course, I know I will get a job. And nursing came up, and I went and had an interview for it. I was terribly hungover on the day of my interview. I remember turning up and not feeling my very best. But I very quickly realised it was something I absolutely loved. So I'd done prep for the interview. I went in there, I did well. I demonstrated to them that I was passionate about making a difference, even if I didn't really know what that difference actually was.
So do you think that was the key thing that actually got you into your training position, the fact that you conveyed your passion and the wish to make a difference?
Absolutely. And I remember the person who was interviewing me said, do you not think you're really naive by saying that? And I said, well, it's an aspiration. I might need to be made more realistic about the scope of that aspiration. But I did just I wanted to, yes, get a qualification, yes, get a job and get some financial security. But if you could do all of that while trying to make the world better for people, then that was a really good thing for me.
Absolutely, completely. So you went into nursing training and you trained to be a general nurse?
That's correct, yes. I thought about doing a mental health nursing course, but I thought actually if I train to be a general nurse, I can always specialise later on in my career if I want to. And I did that in 3 years.
And did you do that locally? Are you from the Suffolk area?
Yeah, so I did it in Suffolk, and I trained to be a nurse, and then when I qualified, I worked in London, and then Nottingham, and then Cambridge, and then came back here later on in my career.
Okay, so and did you just sort of move around because of wanting advancement or to see different parts of the country?
Well, when I qualified, one of the things I was very quickly passionate about was sexual health and HIV. I recognise it's one of the areas that's hugely stigmatised, or particularly at that time, and it was something I really wanted to have a bit of an impact and again, try and make a bit of a difference. One of my very good friends was diagnosed with a chronic STI, and she was really, really upset, and I saw the difference it could make if you were kind and compassionate and listened and supported them, the difference it could make to people like that. So I specialised in sexual health and HIV. I then went to work at Ormond Street Hospital as a paediatric HIV nurse, then went up to Nottingham to work in sexual health care. Then Adam Brooklyn Hospital in Cambridge, where I was one of the managers of the sexual health and HIV services there. So it was more around the opportunities, wanting to move around particularly.
Absolutely. And so, I mean, a lot of people, when they think of HIV, they don't actually tend to think about it affecting children. When you're doing a job like that, something that obviously, with regards to nursing in general, it can be very easily for you to be drawn in. My sister trained to be a nurse. I remember her being a nurse and coming home initially with lots of funny stories during her training of antics and things that happened. And it sounded very much to me like something out of Carry On film. But as time progressed, she really knuckled down to her training, and spent time on the wards and getting involved with patients' lives and the effects that it had on their family and all the rest of it. I could see the change in her. When you're working as a nurse, how do you cope with that?
I think you're right. There are moments of real light and brevity, and there are moments where you have to deal with some very trying situations. And getting a solid qualification through a university is a key way of doing that. Because while you're training, you need to spend half your time in practice and half your time in the university. So it means that you are able to develop the skills that you need to be able to be successful in the future and cope with that. It's not saying it's not hard, and certainly I've dealt with some really challenging situations, but as long as you have good colleagues around you and you're able to ask for support, in my experience, even the most difficult things can be overcome and you can learn from them. And ensure that you have a degree of personal and emotional resilience that is really, really important.
Yeah, it's extremely, extremely wise. And in terms of your role then, what actually led you? Because I haven't actually asked you about your current role, and how did you end up as the dean?
So I was working in the NHS in my last clinical job, and I found myself possibly experiencing a bit of emotional burnout, which is probably quite a good link from your preceding question. I found myself just feeling a little bit stressed, a little bit burnt out. I was commuting a long way. I was a bit tired, and I've always been really passionate about education. I remember when I was a student nurse being asked where I want to be in 10 years by the lecturer, and I said, I want your job, in a nice way. I'd also, literally almost 10 years since I qualified, I looked at the local university where I trained just to see if there was any jobs, and by happen chance there was. So I had just completed, I did a postgraduate, a higher diploma in nursing. I then, while I was working, topped up and got a degree. And then when I got my degree, I happened to look at a job in education and was able to come in to the University of Suffolk as a lecturer. I came in as a lecturer supporting people on widening participation pathways. So people who wanted to come into higher education who hadn't got traditional university experience. I really enjoyed that. And when I joined the university, I did a master's in medical anthropology. I then did a postgraduate certificate in education while I was working full time. And then I did my PhD, which was in sociology. All part-time over a period of 10 years. And then for the last 4 years, I've been, I kind of went from lecturer to senior lecturer to acting head of department to dean of school.
So that's quite a whirlwind career. Absolutely, completely, and congratulations on reaching the role. What would you say as dean now? What would you say was the single most important thing you've learnt on your journey to help you fulfill your role today?
I think the importance of education has been a massive lesson for me. So, having been someone who, like I said, had no education role models, and I don't mean that in a disrespectful way to my parents, who came on that journey and worked full. When I was a student nurse, I worked probably 3 jobs. I was cleaning pubs. I was working in a pub, working in nursing home, and cleaning pub toilets, all to kind of make ends meet during that time. So the importance of work ethic. If you put the work in, you get the benefits, and the importance of investing in your own education. And I guess what I would say to anyone who is at school and thinking, hey, I don't know what I'm to do, or school isn't for me, that's normal and that's okay. We put far too much on traditional education patterns that you must achieve well during your education. I think for me, I have grown and learned so much. I've always studied part-time and followed a non-traditional education route. So invest in your studies and work hard, and everything's possible.
Absolutely, I think that's extremely wise. And so, obviously now the world has been through a very strange 15, 16, 17 months now, and the world has changed a lot. For youngsters who are in education now, I mean, all of us have been through times where we felt really tired and we want to go out and live our normal lives and be sociable beings. So sometimes to keep that momentum going, that effort going, has been hard for the grown-ups, let alone for youngsters. So for youngsters who are in education now, they are surrounded by all sorts of virtual offers about go on this course, go on this course, have a look at this opportunity. And they might be feeling perhaps a little overwhelmed. And sometimes when you're feeling overwhelmed, you end up not really doing anything very much because you're not sure which direction to take. What would you say to young people now who are perhaps feeling a little bit overwhelmed to try and get them to do as you've just said, to actually invest in their own education and actually find that momentum to keep going? What would you say was what advice would you give them?
I don't think I'm particularly qualified to give any real advice. But what I would suggest is don't be too hard on yourself. Don't put yourself under too much pressure. Recognize that sometimes the learning journey can take longer than society thinks it should do. So be kind to yourself, I think, is a really big part of it. But also be open to exploring possibilities. I look back at my childhood and no one ever sat down and said, what do you want to be when you grow up? How can we help you have that conversation? And so I think what I would say to anyone listening here is be kind to yourself. Follow your passion, find something that really excites you and do that. But simultaneously explore every option. If you want to work in fashion, go spend some time looking at what fashion careers there may be. If you want to work in healthcare or law or medicine or science or in sports, or you want to do, the world is literally your oyster. And what's the wonderful thing about this is we have the internet that allows us to explore those options. So I'm saying I'm not able to give advice. Okay, don't be too hard on yourself, follow your passions, but recognize that anything's possible and don't limit yourself. The world may create limitations for you, but don't limit yourself before that the world has the opportunity to do so.
That's brilliant. Reach for the stars, hey. You may only get to the moon, but reach for the stars. I mean, that leads on to a question that's been posted, which says, what careers advice have you had, both at school and during your career? And you started by saying that nobody actually had sat you down and actually said, well, what do you want to do? So did you have any careers advice when you were at school?
There was a very lovely lady called Jane who worked at my school, who was our careers advisor. But while I remember her name, I remember nothing else about her. But not really. I think the best piece of advice I ever got about my career during while working was, I didn't like it at the time. Someone sat me down who I didn't particularly like and said, sometimes you can't go into a job assuming respect. You have to earn it. And while that was a bit harsh at the time, I think her ethos was, things don't always come to people easily. Sometimes you have to work, and if you work, you get the results. And that's something I've internalized. And her name was Jackie. So if Jackie ever hears this, I did take that on board.
Excellent. That's really good. I mean, if somebody were thinking about going into careers now, I mean, you recently did a BBC interview on the radio talking about nursing, and they were talking about, back in February, and they were talking about how there's been a real increase of people applying for careers in nursing, which is obviously great. But what would you say to somebody who was thinking about a career in nursing, knowing that it's now fairly competitive to get into? If they're thinking about choosing A levels or going into a different route, what would you say? What's the best thing to do? You're 16, you finish your GCSEs. What's the next step?
So the first thing to do is to look at universities, just to do some exploration. So if we're talking about nursing, look and see what your local university expects for you to come and join the programs. Look at what your favourite university in the country. If you want to go live in Manchester, look at what Manchester Met say about you, what you have to do in nursing. Use your nursing course as a way of exploring the world as well. And that should help you choose what A levels you want to do and help you aspire. But simultaneously, through clearing these days, it's a very different experience getting on in the programs. But if you're passionate, again, follow that, because a career in any health or social care provision will transform the opportunities. Education is the key to social mobility. It's the way in which we ensure that the lives of our children are better than our lives. We enrich ourselves, our culture, our society, and our future by education. And I talk about science subjects, but actually, if you want to be a playwright, go study playwriting. If you want to go and be a fine artist, study that as well. Because everything you do will be able to develop part of it, will enrich culture in a broader sense. So nursing is great. Lots of opportunities to travel, development, really good pay at times. You've got £5,000 a year to study. At the University of Suffolk, we're building a brand new health and wellbeing building, which is going to be great. But I think, again, follow your passion, just do the research, ask people's questions. And actually, I wouldn't mind anyone dropping me a direct email if they can find me online and say, can I get some careers advice? Because people who care about you and your future will be able to will care about giving you the right advice. And I would very happily do that.
That's brilliant. That's really kind of you. Thank you. I'm sure there'll be people who take you up on that as well. Now, another thing I was going to say is that I remember you saying education is key to social mobility. And is fundamentally transformative. Where did that come from? What inspired you to feel that way?
I think it's because when I've seen so many students, particularly mature students, who thought they were failing because they weren't good at school, they weren't good at traditional maths, for example, and they came into education later on in life, and I've seen them at graduation when they walk across the stage in front of me being cheered on by their friends and their family, and they've achieved something they never thought they could. And I know from there and that growth and confidence, everything else has changed.
Yeah, absolutely. Yeah, I agree there. Thank you. One thing I was going to say is, can you tell us about your work with unicaf, what unicaf actually is and how you came to be involved?
Certainly. So unicaf is a university based in Cyprus, which is all online. And through the university, we've developed an international partnership. and we now deliver a public health master's to, I think, almost 2,000 students across sub-Saharan Africa. So individuals who are living in very non-traditional environments compared to the UK are studying and getting master's qualifications in public health through a partnership with unicaf.
And that's pretty amazing. And how did you come across it? Because obviously without this, they wouldn't be able to do it, would they? Quite simply.
Yeah, it's through my boss, the vice chancellor, connecting the two organisations together.
Wow. Well, that's pretty something to know that the new, that education is spreading to parts of the world where they wouldn't have the opportunity. So that's a wonderful thing to have. When you were growing up, we've had a question posted here saying, did you have any role models?
I was not expecting that question.
Oh, that's good.
I would say yes, but very, very many of them. And I think when you train to be a nurse or you go through any sort of career, you work with people and have some very good role models. And I said, actually, I want to take that characteristic. I want to be a better listener. I want to be a better communicator. I want to learn how to chair meetings better. And simultaneously, I've learned from bad role models to say, thinking, I don't want to be that or have characteristic X. And so many, many, many. And I've learned from all of them. For good or bad.
Along the way, yes. So no one specifically, but just picking up little tidbits along the way. It's interesting you say that.
Probably Dolly Parton, if anybody suggests.
It's funny you should say that, because I can remember the first time I worked in an actual office, and I can remember I was really lucky insofar as it was very unusual at the time because it's a long time ago. But I can remember it was unusual that my manager was a woman. Her manager was a woman, and our director was a woman, and it was really, really unusual in the organisation. And as it coincidentally happened, they were all extremely good in their roles. They'd probably had to work really hard in environments against the odds to achieve what they had achieved. And I don't think I will ever forget them. So Esther, Sue, and Vi, if you're out there, thank you. But yes, because we do remember our role models, don't we? And we do remember what we learn and hope that we will put that in practice. And so again, maybe to youngsters listening, it's like, think of your role models. Who do you want to aspire to be like? Who do you want to not aspire to be like, and put that in good practice?
And I think, remember, you're always a role model. Even when you're not aware of it, people role model on you and your behaviour and your the way that you treat people in any sort of setting. I always think I want to be. If someone was looking at me, if someone was looking objectively, I'd want them to go, he's a nice guy that tries to always do the right thing and the best for people. And if you can achieve that, then I'm quite happy.
That's a very, very good message, and perhaps a very good way to end this afternoon's interview. So, Paul, thank you so much for joining us. It's very kind. I'm sorry we've run over a bit, but I could sit and chat to you all day. Thank you so much for your inspiring messages, particularly for young people. Talking about what's important and what to focus on, and to try and be the nicest and the best that you can be. So that's wonderful. So thank you so much for joining us today.
Thank you.
Thank you. Okay, so that was Dr. Paul Driscoll-Evans with some really good messages about what's important and always remembering to be nice. And also that's important as well with regard to social media as well, because a very important message is that employers often now look very clearly at the social media footprint that we leave. So yes, it's important to do and say the right thing. So that's great. So on Thursday, we have some apprentices coming from Balfour Beatty who are going to be interviewed. So they will be here. We'll be here again on Thursday, the 6th of May at 4:30. In the meantime, thank you for joining us. And do please let us know of any feedback, anybody you'd like to see, or any particular career. We always welcome your feedback. Thank you.